morning we've all met at the School of Arts and we've marched down the main street, Junction Street, to Junction Mall. We're protesting for equality and for staff-to-patient ratios.
1 to 4, over the 4, 1 to 3.
Nurses are rallying here today to try to get public awareness about the nurse-patient ratios.
Our local members, our 2 local Liberal state members, have refused to support us. We've spoken to them and we've written to them. They give us the same answer that all the Liberal members across the state are giving. They say they've employed extra nurses. They don't say how many nurses have left the profession, and it's not old nurses like us that are leaving, it's the young ones, the ones that we need for our future.
It's good to get all the cheers and the claps and people supporting us, even from their cars. Yeah, it was very, very positive. We're all working long hours. We're all being called on our days off to do overtime. We're all running. We're not having meal breaks. We're not having. Yeah, it's hard enough. Sometimes you don't even get to go to the toilet for a shift.
So we'd like you all to sign our petitions today so we can take them to Parliament next week. The more signatures we get, the quicker we get heard in Parliament.
And ladies and gentlemen, while you're here shopping the Pricelines, do come and sign our fantastic petition that is going up and down the streets today. The girls are working very, very hard. It's all of our local nurses and we need that ratio.
Talking to people on the street, getting them to sign our petition, making them aware that, you know, this is what's happening. We're short in hospitals and we need their support.
Ratios up, and our teams have come from all around the Riverina. We've got people from Griffith, Osborne, Gundagai and around the traps here in Wagga, and we're pretty excited.
We thought we'd try something interesting and something new for the campaign, so we thought we'd do something fun and, you know, people will enjoy it and get a message across as well to the government that, you know, we need more nurses on the floor.
Golden no, and that is for those who come last.
Me and my girl went a bowling
Rubbing for a bit of a flashy, yeah.
We got us an alley and things were looking alright. The lanes were crowded and the pins were shining bright. Then all of a sudden somebody pulled a strike.
Yeah, we wanted to come and support all together with our other comrades and colleagues, and fun day and get the message out there.
We've been getting lots of signatures at the sporting venues the last month, which has been fantastic. Just because of where you live, it shouldn't be determined how much hours of care you get.
One day I think there was 8 nurses missing on the morning shift, and I worked from ED to X-ray, back to ED, back to X-ray because there was a shortfall.
Barry O'Farrell, this is serious and it's really disappointing that we have to keep campaigning for safe patient care.
What do we want? Ratios! When do we want it? Now! When do we want? Ratios! When do we want it? Now! When do we want? Ratios! When do we want it? Now! Go!
This evening and we're turning the big banana red. And why are we turning the big banana red? Because we're seeing red. We're angry. We want ratios. We want ratios on par with our Sydney counterparts.
1 banana, 2 banana, 3 banana, 4 bananas make a bunch of so many more. Over hill and highway the banana buggies go, coming on to bring you the banana split show. Picking up a mess of fun. Picking up a mess of fun. Lots of fun for everyone.
Why should any member of the community, no matter where they live, have their health care determined by their postcode?
We all need to stand united and fight this.
We have 50 million cardboard cutouts, but no real people to care for our patients.
And an improvement and extension to our current ratios is not just a nurse issue, it's a community issue. The only reason that the Minister announced the sprinkling of what Brett and I call fairy dust, that's a few little nurse positions around the state, was because you guys have put pressure on the government, letting them know that there are trouble spots in this health system and we need it fixed. So are you all with me when I say to Premier O'Farrell, you can resist us all you like, but unlike you, we will put our patients first and we will not stop campaigning for improved and extended ratios until every last patient in this state is cared for as safely as they should be, however long it takes.
When we want ratios! When do we want it? Now!
We're in for the long haul, we're in for a long fight. We will not back down, we will do whatever it takes.
Barry O'Farrell, we're not gonna take it. No, we're not gonna take it. So you better listen to what we have to say.